have time on their calendar as well. So I'm Julie Haleska. I'm your CAHAM webinar chair. And I am happy to introduce Katie Harwood of the University of Utah. She is Patient Access Manager, and she's also Certification Commission Chairperson for NAHAM. So I'm going to turn it over to Katie and let her start her presentation. Thank you, Katie, for joining us today.
Yeah, thank you. And let me know if at any time the presentation is not displaying correctly. I hope I don't touch any buttons that mess it up, but
I'll let you know.
Okay, great. Well, thank you for inviting me today. I am, as Julie mentioned, the certification chairperson for National NAHAM, and asked to share with you the CHAA and the CHAM certification process, which is my first time doing it. So hopefully I don't miss anything, but if I do, you know, after I go through my presentation, if there's questions that I did not get to, I have my resources to verify information and get back to you. And then also there are some resources that are not displaying in the presentation that I can point you to on the naham.org website. So we'll go ahead and get started. So there's two levels of certification. Oh, sorry, I have to like from the beginning resume, sorry. So we have two levels of NAHAM certifications, and we want to share with you also on how to prepare for the exam, what your eligibility requirements are. And then there's also, once you achieve certification, a process to recertify on a periodic basis to ensure that you maintain that certification year to year, so you don't have to re-examine every time. So we have our CHAA, which is a Certified Healthcare Access Associate, and the CHAM, the Certified Healthcare Access Manager. The CHAA is geared towards those individuals who've been in a healthcare related role for about 2 years, but it's also marketed to those who maybe are in college or some sort of certification program through their local schools, university, that they may become CHAA certified before they work in the healthcare industry. And then the CHAM is geared towards those of us who have been in a leadership role for 2 or more years. And both of these certifications are established to promote the highest standards of patient access services through the credentialing of those who work in a frontline and manager and above levels. So this helps demonstrate the knowledge that we have gained, which are essential to the practice of patient access management. And both certifications have been in place. The CHAA was established in 1999, so it's actually been around for quite some time. And then the CHAM has been around for much longer, since the late 70s. And so both of them are very well established certifications for the healthcare industry. So here we go, a little bit of that overview. The first 2 items I covered on references. When you go to certify or to sit for the examination, you are required to provide a reference, generally of your direct supervisor or someone who's overseeing your course instruction if you're in a education endeavor, and then a CHAM certified individual who is usually someone that can sponsor you. And we'll talk more about CHAM and CHAA sponsors it further in the presentation. Education requirements are a high school diploma or GED equivalent plus 90 professional development hours earned within the last 3 years, or a 4-year degree from an accredited institution in healthcare, business, or other related field. The CHAA is at associate level. And it only requires the signature of your supervisor or course instructor. And then 30 hours of education that is either directly related to work history or the equivalent with associate's degree from an accredited institution. Both the CHAA and the CHAM are the only accredited certifications that are focused on patient access. So it's something that we can take pride in demonstrating the professional development for our patient access staff as they may use this as part of their career development. The testing windows, we have 4 times per year that the certifications may be taken, and those testing windows are approximately every quarter: January, April, July, and October. And the deadline to apply to take the exam is in the column on the right, which just talks through you submit your application by the last day of the month. And that generally gives the person who's intending to sit for the exam time to study and prepare for those appropriately. When you're preparing for the AAHAM exam, there are resources that are available on the AAHAM.org webpage. Some of the items are open to you as someone who just wants to perhaps see what it would take to be certified. So when you go to the website, and I plan on jumping over there after the initial presentation. I don't want to break the links from this PowerPoint, but we'll go over there and I'll show you how you might find this information. There's a certification manual, which has additional details on what you need to do to become certified, how to find a proctor, how to decide whether or not you're ready to do the CHAA or the CHAM. Sometimes individuals, they may want to do a pre-test to see if their knowledge base is where it currently needs to be for them to successfully pass the exams, or also identify areas that they might want to do some additional study before they do go ahead and sign up for a certification. And again, we'll go into those details a little bit further. So for our certification preparation, there's the manuals that are available and study guides. So the study guide is revised on a regular basis to match the competencies tested in each exam, and it provides a wide breadth of information and glossary of terms, both for the CHAA and the CHAM. And then AAHAM has also partnered with Bridgefront, who does certification prep courses, which are available on demand to also help you prepare. And again, these prep courses are specifically designed to help support the knowledge base an individual would need in order to take the exam. And so the Patient Access Services Manual, again, available online, helps you determine, am I ready for this exam? It also provides an outline, a content outline of the different topics that are included within the exam preparation. And then on our CHAM preparation, the study guide was recently updated in 2022, and also the exam. So the exam and the study guide were updated in 2022. And those reflect the most current patient access content to reflect things that face us all today. The most current regulatory requirements, things that perhaps we've experienced since COVID that maybe changed some of our business office practices, and acknowledges some of the realities of, you know, some of us are working from home or not working in a traditional business office. Our exam has been updated to reflect the current healthcare atmosphere for the role that we help support. So when you are ready to sign up for the exam, you will need to create a profile on the AAHAM website. There are two different ways to do it. If you're already a member, you would log in using your credentials. If you are not a member, you would need to set up a non-member online profile, and that is available as a standalone as well. Once you're logged in, you would navigate to the Certification Central under the Certification menu. And so not sure if my mouse is showing up on here, but it's a little, the hat that you would wear when you're graduating has all of the certification tools underneath it. And then once you're ready to submit your application, you click on the Begin button to sign up for the exam. So from here, you can see on the screen here, the CHAA and or the CHAM application to submit the bond to start your exam application. So when you complete your application, you'll initially indicate the, which one you're going to sign up for, and then pay for the cost of the exam. You would select your desired proctoring option by filling out the proctor information section. And we'll talk about this in the next slides. We have either virtual proctoring available or in person. And once you pay your fees, you'll receive a notice to schedule your exam within 2 weeks of the exam or testing window. So this, again, it talks about that proctoring information. Are you participating in remote proctoring? And we'll talk about that a little bit. This is an option that we have been able to make available as, again, some of our members are no longer in a work environment where it's easy for them to get on-site proctoring. So AAHAM has been able to partner with an accredited organization to provide remote proctoring. So what is that? Standard proctoring, which is the way I did it, is you have someone in person who is able to oversee the administration of the test. They're in a room with you, you log into a computer, you show them your ID, and they ensure the integrity of the test environment by making sure that you don't have anything except what is absolutely allowed by AAHAM criteria for note-taking, etc. And they are present for the whole time of your exam in person. Generally speaking, in some organizations, it's a training department or training team that helps assist with proctoring. And sometimes the proctor is another CHAA or CHAM certified individual. With remote proctoring, you can arrange to do it at home. The proctor is provided by a vendor, and the exam time and date is set by the candidate within the approved time frame. So it is the responsibility of the candidate to schedule their exam using whichever one up front. Prometric is the vendor that AAHAM has used in order to provide the remote proctoring. And when you're selecting the remote proctoring, because it is provided by Prometric, you don't need to know who that individual is. It will be provided for you. So if you're looking at the standard proctoring, that's where you generally need to identify a proctor in advance of the application or as part of the application process. Then we have recertification. Recertification is once you successfully complete the exam, you maintain your certification with every other year, so every 2 years for both the CHAA and the CHAM. And both are done in June of every other year. In the past, some of you may be familiar, there was a different time frame for the CHAA versus a CHAM. We moved them both to June just from an administrative standpoint. It's easier to administer. And so this information is the most current. The website, I believe, still indicates that one of them is in April, but this is the most current info. The difference in requirements is in the contact hours. So the CHAA, being that healthcare access associate level, only requires 30 contact hours and the payment of the recertification fee, in addition to working the minimum number of hours in that period. For the CHAM, it's a minimum of 60 contact hours, with 10 of those being NAHAM approved contact hours. And we can go into what are some of those contact hours that either qualify as NAHAM approved and or other continuing education contact hours that qualify. One thing that makes it easy to recertify is events like this count towards our contact hours. And also National NAHAM provides some free seminars throughout the year, and also on-demand webinars are available as well. So if you can't attend within a specified time frame, you can download and watch at your own convenience some other webinars, which can count towards your contact hours. Okay, so now we're into the resources I wanted to go into, and this is kind of more of the navigating the website to get there. Now, I think my links may not work directly from here. We'll try. Yeah, it's not working here. So what I'm going to do is escape out of here, and I'm going to go directly to the naham.org website to show you some of the certification. So my screen sharing stopped for just a moment, and I'm going to go back to sharing my screen. Okay, am I showing a naham.org webpage?
Yes.
Okay, great, thank you. All right, so we're going to do a little bit of just show and tell through the actual website of the things that I think are the most useful to get to familiar with on the certification. So we have our certification button, which has a drop-down menu of all the information you need to learn about how to get certified, how to maintain your certification, the FAQs that are specific for it, the manual, our contact hour guide, which I think is really helpful for those of us who are already certified and required to submit our contact hours. And I might, if it's of interest, talk about that a little bit. And then going into our currently certified list, some of this helps with finding proctors and other individuals who may be able to provide that sponsorship for the certification process. So here we have our, I wanted to go into the Get Certified. So here you have a certification justification toolkit. This is something that you may be able to use if you're interested in being certified and supported by your organization. This has some helpful information on how you might promote that for yourself to your leader in the event that they're not already someone who helps promote NAHAM certifications. That just helps, you know, sell your story, build your story for that. And then on our proctoring options, this is really where people struggle. What I would say the most is trying to identify an appropriate proctor, especially, so for instance, in my organization, there used to be a fair number of leaders who were active CHAM or CHAA certified, who've allowed their certification to lapse. And so there's only a few of us that can still proctor. It is important to note that proctor does not necessarily have to already be CHAA or CHAM certified. There are some notes here where you can talk about qualified persons. So qualified persons generally, as long as they're not your direct supervisor, that they can do the steps to become a proctor for your organization. And so that is something that some people may not be aware of. And then we have additional links down towards the bottom of this menu that you can go to find your process for following the standard or remote proctoring. And then the AAHAM proctor database is helpful for those of us who, oops, this is saying I don't have access here, but I have gone into it in the past. You can get into it and find people who are AAHAM proctors nationwide. And sometimes people are willing, you know, if you're in the same state and it's not a hardship for you, you know, if you live in an area where it's easy for a person to travel to you on a volunteer basis, they might proctor an exam. So for instance, again, I live in Salt Lake City. There's a lot of different facilities within our area within 30 miles of each other. And, you know, for us, if somebody were to reach out to me, that wouldn't be a hardship for me to travel to somebody within that type of a distance to help them take their examination. And then going back up to our certification button, home, then we have our maintaining certification. And there within here, this is where you can track your contact hours, and the contact hour guide is in here. And that's something where I think it's helpful for new or members who are not familiar with all of the different contact hours as far as what is an approved contact hour. And so this shares with you the AAHAM approved contact hours, which are AAHAM's generally sponsored activities, either through the attendance at conferences or webinars. There are different committees that you can be a part of, all sorts of committees actually. And this, for instance, this was one way for myself as a certification chairperson. I was on the certification commission as just a volunteer team member, you know, for the last 10 years or so. And so those hours I spend as a volunteer count towards my contact hours. And then going into, if you are affiliated with some other professional organizations, you can also claim those as contact hours. I happen to be a member of AAHAM as well. And so part of my role with AAHAM, I can count those contact hours as another association's hours. And then there's a professional development that your own organizations may provide to you. So here we have employee-sponsored education, and this talks about, you know, the structured training classes that you may attend in your own organization. Or here we have participation in disaster and emergency preparedness exercises. You know, if that's part of your role in your organization, that's something that definitely can count. And then we have system implementation. So those of us who are super users or testing points of contact for our ADT systems, that type of work can count towards your contact hours. And then if you are attending vendor sponsored events, other professional organizations, those can count. And community volunteer, if you are volunteering outside of your work role, you can count some of those activities as well. And those of you who may be teaching in different environments, that counts. And students, students can count a portion of their time spent as a contact hour. So there's really no reason why an individual shouldn't be able to maintain their certification through submitting these different contact hours. You just have to, I pull this list up every year, and I try not to let my tracker, my contact hour tracker, stack up for too long, because that can be a little bit overwhelming to try and fill that out. If you're doing it like right before it expires, I wouldn't suggest waiting to compile this list, but just going in periodically, maybe once a quarter, and just tracking what you did in the last 3 months in order to keep this up to date, so it's not too cumbersome when your 2 years calendar date comes up for you to get your certification tracked. And then this talks about the retroactive maintenance program. So that's definitely like something I wouldn't recommend. But if you let your certification lapse, you can apply to have a retroactive review provided. And, basically is compiling that 30 or 60 contact hours and submitting it and hoping that, whomever is approving the retroactive extensions is likely going to do that, but it's a lot of work on your part. It makes it more work anyway. And then I wanted to go on to the certification manual that talks a little bit more. This is like the very detailed information. Now, this is a little bit out of date, but the contents are what I would say, the subject of everything in here is pretty much the same. There's just been a few updates as far as, like I mentioned, the time frame in which recertifications occur is in the same month for both the CHAA and the CHAM. And then this also probably does not acknowledge the remote proctoring option. But for the most part, this manual is very helpful, and it's like very detailed in how the Certification Commission approaches developing the CHAA and the CHAM exam, and the frequency in which we make updates, and all of that information is included here. So I'm going to take a step back. And I think those are going to the FAQs. This is kind of like the most commonly asked questions on what individuals have really asked in the past. And we just kind of keep this list up to date and provide information on here for individuals who have questions. And that is the majority of the content I wanted to share today.
Thanks, Katie.
I like Lena shared here that contact hours may be obtained by attending the annual CAHAM conference, which is good to know. I'll also put a plug in for the national conference, which is going to be May 2nd through the 5th this year in Orlando, Florida. For those of us, me here in Utah, I'm looking forward to that and having a little bit of sunshine. Although California would be more convenient to get to.
Hey, I want to open it up. Does anyone have any questions for Katie? Anyone have any questions?
Hi, this is Wendy. Can you hear me?
Yes,
Hi, is there a fee for the proctoring for the vendor proctoring?
Oh, that's a good question. Let me look at my notes really quickly. I think it's actually just included in your fee to do the exam in general. So there is a fee when you submit your application, and that fee includes the cost of the proctor. It's not on top of that.
Okay, thank you.
I don't have the fees right in front of me with the most current ones. I believe those will be in our certification guide here. If I click on my Get Certified, let's see. Am I still sharing my?
yes.
Okay, just want to make sure. This is interesting. I don't think I've been. For some reason, I'm getting a block screen or something. Let me go back here. Ah, here it is. Or maybe not. Let's see. It doesn't say there.
Also, if anybody has any questions, they can put it in the chat too.
So here's our certification application. Taking a look. Mine is just contact hours. So I had logged into my account and it's just showing me my options for certification since I'm already a certified member, but I can find out the current costs and give that back to Julie, if that makes sense to send those to
Sure.
you.
Definitely.
Okay.
And I'll get it to the group. Anyone else have any questions for Katie? No. Well, Katie, I want to thank you so much for your time today and everyone on the phone and the web. I appreciate it. And if there are not any other questions, Terry, did you have anything you wanted to say?
Let me unmute there. Thank you, first of all, Katie, for, sticking yourself out there and doing this for us. I think, it's not always clear on the website, so definitely appreciate somebody who has a little background in this as well. And hopefully that we can encourage the others that have joined us, to go for it. I will tell you that I had a CHAM and I let it lapse. And so it was important for me to be on there as well. But for those of you that don't know me, I'm the president of CAHAM. And Lena is on here as well, who's on the board. And I think that's it from the board today. But she did put a little note in the chat too, as well, about possibly, joining CAHAM and coming to the conference this year as well. And that would give you a lot of those hours that you need to qualify. It's usually between 11 and a half and 15 hours. So that's a good start for as well. So we'll probably, if you all don't mind, probably send you a little information on the conference as well, and get you possibly certified.
Excellent. Oh, there we go.
Oh, thank you, Christina. Found the exam fees. CHAA is $155 for both members and non-members, and CHAM is $225 for members and $425 for non-members. So you'll notice there's that significant difference, and that's just really to encourage those who are interested in getting their CHAM certification to be a national member. There are lots of benefits that I didn't even get into, as far as you receive access to resources within NAHAM's site that non-members don't receive. And so some of the things that I, as a manager, have found very useful is they have a salary and benefits survey. That's something that is in the process of being updated. You'll notice it says here 2017 was the last date, but this is where we compare what our patient access staff and other supportive roles are getting across the country. And so that helps to benchmark ourselves against, is my organization competitive with others? And if not, can we use this information to help promote that for our senior leadership who approves those increases? And then under education, there's also special pricing for what I would call kind of frontline education for patient access staff who may be able to, again, if you don't have a dedicated patient access training and development team, it talks about those key concepts of how to run a business office, how to have excellent patient experience, what are best practices for prioritizing the patient flow within your areas of responsibility. So those are other benefits of becoming a national member. And one thing I also want to kind of put a plug in for the national is the access keys. This is our benchmarking against other organizations. So not in my scope as part of the certification commission, but again, this tells me my productivity I can expect for a variety of roles: patient prior authorization, financial counseling, registration, scheduling, all of those different functions that in some organizations are very siloed, or in other organizations, smaller places where you have your patient access staff doing everything. What kind of productivity can you expect from them, and how many FTEs do you need? So all of these tools become available to you as a member of NAHAM.
Great.
Kate, did you happen to know if there are any job descriptions on those links?
You know, that's a good question. I want to say, I thought that there were, but I haven't looked at the detail lately. But I do know that's part of, you know, what is the scope? The access keys, for instance, shows, do you have an individual, an FTE, I guess I would call it, who is responsible for these activities, and what level of activity are they required to do? So do they do scheduling and registration? Do they do cash collections? So I don't know if it's a job description per se, but it's definitely, it outlines the scope of what a patient access professional can be expected to do, and how many of them you might need in order to accomplish that based upon your clinic or your hospital's volumes for those areas of responsibility.
Yeah, I do hope that more people, especially with CAHAM as well, will focus on these access keys for best practices. I know that we're a little behind the 8 ball at my organization, but I've asked my managers to load those and see what we could do to, put in to get that, to qualify for that award, et cetera. But I have a manager that's leaving, and her job description is quite old, and I wanted to see if there was something on here that I could just.
Yeah, and especially at manager level, I don't know that I've seen that on the website. I think if you put that out there, I mean, if you want to email me, I'd be happy to share what our job description is for a patient access manager at University of Utah Health.
Okay.
And like if she had a specific area of expertise. We're big enough. We have like a prior auth manager, financial advocates. I'm the admissions and emergency registration manager.
That's the one I need.
Oh, well, I'll send you my job description. If you want to, what was your contact info?
It's Terry Clausen, so it's on there. So it's terry.clausen@choc.org. I can put it in the chalk.
Yeah, that would be great. Oh, I see.
Mhm. Thank you.
Sure.
And I'm not seeing in the chat yet.
There you go. She just put it in
Oh,
there.
got it. Okay.
Yeah.
CHOC.org. Okay.
Yeah. And just one other thing that just came up as well. We do AAHAM does give a discount to, so let's say you're a NAHAM member already, and we would encourage that as well. But we do give you a discount for the conference if you are a NAHAM member.
Well, if there's no other questions or any other items to go over, I think we will turn it back over to everybody to get back to their day. Thank you, Katie, so much. We really appreciate you.
Yeah,
Yes.
thank you for the opportunity, and have a wonderful day.
Thank
You
you.
too.
Thank you so much, Katie.
Thanks,
Bye-bye.
everyone. Bye-bye.
Thank you. Have a good afternoon.
Thank you. Have a good afternoon, everyone.
Bye, everyone.